This is the calculated strategy of a war waged against the poor. Our leaders constantly feed us a narrative of individual failure, telling us homelessness is a choice or a simple matter of addiction. This is a profound lie. In reality, over 36% of unhoused individuals are employed, yet they remain unhoused because the housing market is mathematically impossible to enter. It's time to stop accepting excuses and expose the sick systemic lies used to justify policy choices that maintain, rather than solve, this crisis. Lie number 1. The most insidious of political lies is the notion that people exist on the street by choice, claiming they prefer the freedom and lack of societal strictures over perceived burdens of housing. This narrative is frequently deployed to absolve local governments of responsibility, suggesting that the problem lies solely with the individual's refusal to conform. However, this simplistic framing ignores the brutal mathematics of what analysts call the coercive economy. The National Low-Income Housing Coalition's 2025 Out of Reach report confirms that in no state, metropolitan area, or county in the United States can a full-time worker earning the federal minimum wage afford a modest 2-bedroom rental home at fair market rent. The national housing wage required for a modest 2-bedroom is $33.63 per hour, meaning the federal minimum wage of $7.25 falls far short. When rent consumes over 100% of a minimum wage income, the ability to make a choice about where to live is fundamentally removed. The system is rigged to force millions into housing precarity. When these individuals turn to government programs for assistance, they are met with a similar wall of denial. The average waiting period for a Section 8 housing voucher, which subsidizes private market rent, stretched to 27 months in 2024. In high-demand cities like New York and Seattle, these wait times can easily extend to 5, 8, or even 10 years, if the public housing authorities have even opened their application lists at all. The notion that choosing to sleep in a tent is a preference for freedom over a safe home is a catastrophic misreading of an economic landscape where the minimum entry price for stable living is now physically unattainable for the working poor. Lie number 2. Another frequently repeated lie seeks to reduce homelessness entirely to a medical problem, suggesting that if everyone simply went to rehab or received psychiatric care, the tents and encampments would vanish. This is a pathology explanation, a convenient way to sidestep economic and housing policy debates. However, the data overwhelmingly supports the housing theory of homelessness. The core tenet of this theory is simple: the availability and cost of housing, not the rate of mental illness or addiction, is a primary driver of unsheltered populations. To illustrate this, one can compare 2 regions. States like West Virginia have among the highest per capita rates of opioid overdose and substance use disorders in the nation. Yet, they possess a relatively low rate of chronic unsheltered homelessness because housing costs remain comparatively low. Conversely, high-cost cities like San Francisco, Los Angeles, and Seattle, despite having robust mental health services, host massive unsheltered populations because the median rent far outpaces the average income. A 2022 study found that differences in per capita homelessness rates across the country were not due to variations in mental illness, drug addiction, or even income poverty, but to differences in the cost of housing due largely to acute housing shortages. The truth is that while addiction and mental illness are significant struggles for many unhoused people, the trauma and instability of living on the street often causes or worsens these conditions. The lack of a door and a lock is the initiating factor, turning a vulnerable person into a homeless person, who is then much more likely to develop secondary, complex health issue. Lie number 3. The lie that homelessness is a result of sheer laziness or rejection of employment is perhaps the easiest to dispel with current employment statistics. This damaging stereotype allows the housed public to maintain a moral distance, believing that the unhoused simply need to pull themselves up by their bootstraps. However, the phenomenon of the working homeless is a statistical reality, proving that employment alone is no longer a guaranteed exit from housing insecurity. While official figures vary by region and methodology, one analysis of service data found that a significant proportion of people in shelters, often cited to be over 1/3 in some major cities, are employed either full-time or part-time, but still cannot afford stable housing. This reflects a 2024 calculation that, nationwide, the average renter wage of $23.60 per hour is still $10.03 less than the housing wage needed to afford a two-bedroom rental. The working homeless are trapped by a brutal financial equation. Their minimum wage income is typically sufficient to cover one major expense, say, a used car payment or basic food, but it is mathematically impossible to save up the necessary capital to enter the housing market. For a renter to secure a $1,500 apartment, they often need $4,500 to $6,000 for first, last, and security deposits. For a person earning $15 an hour, that is over 400 hours of pre-tax work, or 10 full weeks, just to secure the down payment, all while simultaneously paying for food, transportation, and their current temporary lodging. The economic system has created a vast class of workers who are essential to the low-wage service industry, but are simultaneously deemed disposable enough to be denied the most basic necessity of shelter. Homelessness is not a lack of effort. It is a structural fault line in the affordability sea. The criminalization trap. When economic policies fail, legal enforcement often steps in, creating what has become known as a criminalization trap. This strategy is less about justice and more about removing visible poverty through a complex web of petty ordinances. Following the U.S. Supreme Court's June 2024 ruling in Grants Pass v. Johnson, which upheld laws penalizing unhoused individuals for sleeping in public spaces even when shelter is unavailable, cities across the country escalated their enforcement of anti-loitering, anti-sitting, and anti-camping laws. A 2019 report by the National Law Center on Homelessness and Poverty found that 72% of surveyed cities had at least one law prohibiting camping in public. The primary mechanism of this trap is the fine. When police issue a ticket, perhaps $150 for illegal camping or $200 for public urination, to a person who possesses zero income, that fine immediately becomes an insurmountable debt. The unhoused person cannot pay the fine, which then leads to an arrest warrant. Once arrested, they are shuffled to the criminal justice system, jailed, charged, and released, now burdened not just with poverty, but with a criminal record. This creates the poverty-to-prison pipeline. The record itself makes it nearly impossible to pass background checks for low-income housing or secure formal employment, ensuring that the revolving door of incarceration continues indefinitely. The financial cost is staggering. A University of Denver study found that 6 Colorado communities spent over $5 million in just 5 years simply enforcing 14 anti-homeless ordinances. This money could have directly funded hundreds of housing placements, demonstrating that criminalization is not only morally bankrupt, but economically foolish, actively blocking the path toward self-sufficiency. Lie number 4. The popular refrain, "Why don't they just go to a shelter?" assumes that the shelter system is a universally safe, available, and welcoming resource. This is a profound and damaging misconception. The national reality is that the shelter system is perpetually overwhelmed, operating as emergency triage rather than a long-term solution. In the January 2024 national count, over 270,000 people, 36% of the homeless population, were unsheltered, largely because of a sheer lack of available beds. Furthermore, for those who do find a space, the experience is often harrowing. The reasons people avoid shelters are pragmatic and rooted in self-preservation, fear of theft, violence, and pests. Congregate shelters, where hundreds sleep in open rooms, are common sites for theft. A person's few vital possessions, ID, medication, work tools, are constantly at risk. Safety is also a major concern, as high rates of violence have been reported within these facilities. Crucially, shelter rules frequently interfere with stability. Many facilities enforce rigid curfews that conflict with the schedules of night shift jobs, forcing the working poor to choose between maintaining employment and securing a bed. Most shelters prohibit pets, forcing individuals to abandon their companions, often their only source of emotional support. The system also often separates couples and even older children from parents, splitting up families who are trying to weather the crisis together. Rather than being a true solution, the current shelter system often serves as a stopgap measure that can strip a person of their autonomy and dignity, making the precarious life of a tent or vehicle appear, to the individual, as a more rational and safer option. Lie number 5. The narrative that unhoused people are violent criminals is a powerful, politically manufactured lie designed to foster public fear and justify aggressive, military-style police responses, known as sweeps. This emotional appeal creates a moral justification for exclusion, allowing the public to see the unhoused population not as vulnerable people in need of help, but as a collective threat to public safety. This perception is then used to advocate for punitive policies that clear encampments and push poverty out of sight. The data, however, completely reverses this moral calculus. The statistical reality is that unhoused people are exponentially more likely to be victims of violent crime than they are to be perpetrators. A 2017 study by the National Healthcare for the Homeless Council found that almost half, 49%, of people experiencing homelessness reported experiencing violence, compared to a rate of only about 2% for the general population. This demographic lives in a constant state of hypervulnerability, lacking the basic protection of a locked door, making them easy targets for assault, robbery, and worse, often perpetrated by housed individuals or, in some cases, other unhoused people. For women, in particular, the risk of sexual assault is drastically higher. The persistent media focus on rare instances where an unhoused person commits a violent crime disproportionately distorts the facts, leading to a pervasive, dangerous myth. The danger narrative serves as a political lubricant for police raids. By making the housed population feel unsafe, it generates public support for the destruction of encampments and the seizure of property, policies that destroy what little stability the unhoused have managed to build. This lie is not only inaccurate, it actively endangers the very people it purports to describe, encouraging a climate of fear and dehumanization that allows violence against them to be overlooked. Lie number 6. The final and most powerful myth, the one that paralyzes political will, is the economic lie that we can't afford to house everyone. This is framed as a responsible fiscal position, suggesting that solving homelessness will require unsustainable taxpayer investment. However, this argument ignores the massive hidden cost of not housing people, a metric known as the cost of doing nothing. When an individual is chronically unsheltered, they become a high-frequency user of the most expensive public services. They use emergency rooms for primary care, are repeatedly admitted to detox centers, are cycling through jails and courts, and require constant, specialized policing and cleanup crews for encampments. Data from a National Alliance to End Homelessness reveals that a single chronically homeless individual costs the taxpayer, on average, a staggering $35,578 per year through these crisis services. Contrast this with the cost of providing a true solution, permanent supportive housing, PSH, which provides a subsidized apartment and case management services, costs, on average, approximately $12,800 per year per person. The difference is a net savings of roughly $22,778 per person per year. Numerous pilot programs across the country have confirmed this. For instance, a Denver supportive housing program costs between $12,078 and $15,484 per person annually, but resulted in public service cost savings, mostly from reduced jail time and ER visits, exceeding half of that cost, in many cases paying for itself over time. The $8.2 billion estimated cost to rehouse every adult household in a shelter is large, but it pales in comparison to the billions currently being inefficiently spent on the revolving door crisis management. The too expensive lie is a cover for profound failure priorities. We are not too poor to house people. We are simply choosing to waste vast resources on punitive and ineffective measures that perpetuate the invisible war against the poor. The only financially responsible solution is to stop managing the crisis and finally decide to end it.